So as usual, I'd ask everybody to mute your microphones and turn off cameras except when you're speaking. That'd be great. And post your questions in the chat. I'll try and keep an eye on those. Or when we're actually calling for questions, raise your hand. So if that's all clear to everybody, I'll ask Annette to share her screen and kick us off. Oh, I should say one other thing, and that is that we're recording this seminar. So just be aware of that. The recording has now started. So thank you, Judy, for that.
Okay, thanks, Robin. Can you all see my slides?
Yes.
Great. So I'll just quickly, yep, change that. Good. So this is actually the slide for the overall event. So I didn't put them all on the agenda, which Robin just said. And yeah, as you said, my name is Annette Krohn. I'm working on the early delivery of equitable and healthy transport options in new suburbs project together with a lot of other presenters here and our whole team. We'll have the list of names later. And before I start, I would also like to acknowledge the Wurundjeri people of the Kulin Nation on whose unceded land I work and live, and pay respect to their ancestors and elders past and present. And actually, when I prepared this presentation, it wasn't that easy to pick what to present, because 20 minutes from a 3 years project is not that easy to show everything, or it's not possible. So actually I had to select a few things. If you're interested in more details, just contact us later. And I'll start with this slide, and this is just really mainly, I think it shows quite well what the problem is that we are looking at, and it's from an ABC story last year, where yeah, this was about someone living in Tarneed in Wyndham in the outer suburbs and having a ghost bus stop in front of his house. So obviously a bus route was planned, ghost bus stops were put in, and but they haven't shown up yet. And this is really what our project is about. In that sense, we are looking at growth areas where high levels of population growth are putting pressure on housing and infrastructure development, and where public and active transport infrastructure and services are often the last to be delivered. And this is impacting on, well, behaviors and health of residents. So in a way, we wanted to look at how you can deliver transport options earlier, and well, have looked at different parts for that. And the reason why we did that was really that we think it's important for equity reasons, but also, well, with fewer people using cars, you have less, with that higher productivity, fewer greenhouse gas emissions, and also health benefits, as just mentioned. Just quickly, so we have a number of project partners, and as Robin mentioned before, this project is funded by the RMIT and Futures Enabling Capabilities platform, but also by partner organizations. And yeah, the project team listed here as well. I don't want to go into too much detail, but just so that you can see who we are working with. And in this project, we have 3 main research approaches. Today, I will actually be focusing on those 2, the policy analysis and also our GIS analysis and the funding approaches. The resident survey and interviews, of course, has also interesting results, but we will focus on that another time. And just to start, yeah, I'll like to start with our ongoing work, actually. So this project is, well, going towards its end, but actually, so in a way, we want to finish our final report early next year, maybe March or at some point, but we'll then have a bit of time to do more things. That's why we still have ongoing work. And this is really looking at scenarios for the early delivery of transport options and calculating the costs and benefits. So answering these questions. So how much more expensive is early delivery actually? Which infrastructure makes a lot of difference? To what extent would sequencing of growth make a difference? But also to what extent is earlier better, and why? And what are the benefits of early delivery? I've already mentioned a few benefits, but we really want to put some numbers on that, but we're still working on that. So unfortunately, can't present any numbers yet. So for everyone who is not from Melbourne or Victoria, I wanted to briefly explain how growth areas planning is done in Melbourne. And we have the precinct process, which is in place since 2006. There have been PSP guidelines since 2009, which are currently under review. Actually, the new draft guidelines are out or have been out for comments until last week. So there are a few changes there. Then precinct structure plans, PSPs, are the instruments which the growth areas are planned. They are mostly prepared by the Victorian Planning Authority in cooperation with other stakeholders such as councils, departments, utilities, and they are then incorporated into the local planning schemes. The actual master planning, so that more detailed planning, is then later undertaken by land developers, which of course then is to be approved by local council. Another important process or program for the for PSP planning or growth areas planning is the growth areas infrastructure contribution. So there are two types of development contributions in Victoria or in Melbourne growth areas. So you have the developer or infrastructure contribution plans, which are for local developer contribution or for local infrastructure. And then you have the growth areas infrastructure contribution, or GAIC, which is actually supposed to or was implemented to fund the cost of new state-funded infrastructure for Melbourne's growth areas. It applies to land which was brought into the growth boundary since 2005 and is charged as a per hectare rate. The GAIC is expected to collect around 3 to 3.5 billion from 2010 to 2040. So it was established in 2010 and is estimated to meet around 15% of the total cost required for state infrastructure and services in growth areas. There are two funds for that. One is the Growth Areas Public Transport Fund, and one is the Building New Communities Fund. Transport, well, public transport is obviously for public transport. I guess the important bit for us is that actually a maximum 5 years of recurrent public transport operating costs can be funded, which means that bus routes can be funded through that. For the Building Community Fund, interesting for this project is that there are walking and cycling infrastructure is in there as well. So that just that people who are not from Melbourne have a bit of a background. So one thing that we did, we had a look at the precinct structure planning guidelines to look at, well, are there actually form elements in there or mentioned, responded to, which are conducive to active and public transport. And those form elements we got from Lit Review, and this includes local destinations, mixed land uses, density, street connectivity, and other things like open space. And in a way, we actually found that most of these elements are already in the PSP guidelines. So they're planned for. I guess our main criticisms were really that we thought that the envisaged densities are quite low. There was an average of 15 net dwellings per hectare, and we would recommend to change that to at least 20 dwellings per hectare. Then another element stated that 80 to 90% of households should be within 1 kilometer of a supermarket. And again, we would say 500 or 800 meter would be better because it's walking distance. And then the question is, of course, how can local destinations like town centers be implemented earlier? How can this be planned for, as this is also really important for active transport? And as I mentioned before, there are actually new draft guidelines out there. So I've quickly put up what they actually say. So actually, there is now an increased density, well, with a minimum of 20 dwellings or more per net developable hectare. So that has changed. Again, well, more would probably still be good, but it is a bit more now. And similarly, there's now talk about 800 meters of an activity center. And there's also acknowledgement that mechanisms to support early activation of the activity center should be explored. After having a look at this, what do the guidelines actually say? We had a look at the outcomes and the actual outcomes on the ground. So really compare what is out there and compared it to Greater Melbourne, but also to some inner areas in Melbourne. And so we have the growth areas overall, that are all complete PSPs. And then we looked at Truganina South, a PSP, which is one of our case studies, and then Silendra Rise, which is a suburb within a PSP. And one thing you can see is really, well, the average distance to the nearest activity center is much better in the inner areas, and also for the average distance to any public transport stop, similar with Greater Melbourne. But you can also see that it's actually quite different between the growth areas. So for example, Truganina South has 3.6 kilometers to the nearest activity center, whereas Silendra Rise actually only has 1.3 kilometer. And the reason for that is actually that there is a town center planned in Truganina, but it hasn't been built yet. So once it will be built, the results will be better. But that shows how early delivery actually would be important to have good results, because these people there, I think they've moved in there since 2012. So for them, it would be really good to have a town center now. The other thing that we looked at was also net dwelling density, which is on average 10 dwellings per hectare in growth areas. So it actually doesn't come up to the 15 dwellings per hectare planned. Again, this might be a thing that PSPs are already completed, but not completely built. So maybe the higher densities are missing, and once everything is built, it might be higher, but if you look at it now, it's just 10 dwellings per hectare, which is not very high. And I actually have a first conclusion from this side. And that's really, in the transport option in growth areas, it's more an implementation problem than a planning issue. So a lot of things are planned for, but the question is really then what comes out on the ground and how can you actually improve that process. The planning for new public transport is actually determined by state budget processes. And even though the PSPs, they plan for bus routes, they have bus capable roads, so there are bus routes in there, but how these bus routes arrive at those suburbs is actually dependent on funding processes, business cases, budget bits, etc., and of course the overall available funding. One thing is that GAIC actually already gives the opportunity to get some public transport only for the growth areas, which is an advantage. Can also be seen as a bit critical if you have other areas where there is a strong backlog. But so maybe I should have mentioned that we actually did a few interviews, 30 interviews with people working in the growth areas, planning and transport planning. And a lot of them said that it's actually still good to have this specific growth areas planning or funding to be able to actually put in something. And in that sense, we would agree with this, because you want to have at least some early delivery. And for business cases, at the moment, the problem is in that sense that the normal planning approach, it assesses needs on population figures. And of course, in growth areas, there are not that many people there at the beginning, but then at some point there might suddenly be a lot of people, and then you need the infrastructure. So the question is really, one thing could be an opportunity to consider opportunity costs of not providing a certain service or infrastructure in business cases, because that would add to, well, everything considered. And the other option is to have temporary services and structures. And I'm well aware that not a lot of people are fond of temporary services and structures, especially with bus routes. It's very hard to take a bus route away again once it's there. But we still think that there is some option in that you make it really clear it's a temporary service. Maybe you have a little bus fleet which can actually go through the growth area before the real bus route is put in, and then the little buses go to the next growth area. It's not a simple process, but it could actually assist in having transport options earlier in the suburbs. Then, well, obviously, growth areas need an integrated approach, so all departments need to look at it, and ideally, actually, a strategic plan and better sequencing of growth, because that would also help with planning for transport options. So then, different stream in a way, we looked at funding options. Because, well, especially putting in public transport in growth areas will be expensive. So we looked at what could you actually use what funding sources could you use to fund these services. And we look at a number of them. I'm not sure if you can all read that, and this is really just an overview to show what we looked at. And we looked at, in a way, at transport pricing and at different elements, at beneficiary charges, and also at different taxes, which would be useful. Looked at potential revenue, reliability, equity, implementation, how easy it is, and travel impacts, and then the time frame. So how long would it actually take to put that in? And in a way, the most promising options are the ones that are most difficult to implement, which I guess is logical because otherwise it would have been done already. And this is transport pricing and a broad-based land tax. We think that they are probably the most promising ones. Then, of course, because that will be a long-term option, you could look at existing options because they are the easiest to implement, but they often have a lower revenue potential and are more or less maxed out. One option that we think could be used more intensively until longer term options are implemented are, for example, the GAIC, which is why I talked a little bit about that. And overall, I mean, the money needs to come from users and beneficiaries to fund public transport options. And these can be beneficiaries of increased land prices, but also increased accessibility and decreased car traffic. So I've actually said most of this, so we'll go further. Then the growth areas infrastructure contribution, as I just said before, so we think it's a good opportunity for implementing some infrastructure or services earlier because it's specific for the growth areas. And I mentioned the 5-year recurrent public transport service. This is not liked by everyone. I think a lot of people would prefer to have infrastructure services, especially because if you put in a 5-year recurrent service, as I said before, it's not very easy to take a bus route away. So that might be a bit contested. But if you choose the bus routes wisely, we think it's actually a good opportunity for putting in some services earlier than they would normally come. Again, when we talk to the people working in the growth area planning, in transport planning, we could see, and also actually I should mention, we also talk to developers. There is a desire for a strategic plan or strategic commitment from the state towards infrastructure investment. Yes, we have Plan Melbourne, but we don't really have an infrastructure plan or a transport plan. This strategic commitment would assist with stronger alignment with the broader planning framework, but it would also assist with sequencing of growth and development, because if the state has committed towards something, local councils can actually say, okay, we'll also focus on the same area. Then there is a need for a better government internal coordination, but in a way it's on its way. Some of it is not public, so we don't really know what's happening, but from what we've heard in the interviews, there is definitely better coordination now. And this is also addressed in the new PSP guidelines. The current funding decision process for GAIC is somewhat problematic because there are two pots in a way. So projects can be either funded through the budget process or through an application process, which is government internally. And then, yeah, so the conclusion. So last slide. Actually, you could say that a large part of essential infrastructure is already there early. So this is built through developers, councils, for example, footpaths or parks. They are all built early. But then you have other infrastructure, which we would argue is essential as well, which is public transport or active transport, and also town centers. And these are usually lagging. And this is because these infrastructure and services are dependent on viability measures. So in a way, I think there needs to be more research on how you can, or well, we need to figure out better how you can actually put some of it in early. Then the other thing is a dilemma between affordability and infrastructure. And this is the background is that in a way the PSP or the urban growth boundary was put in to keep land affordable, to have enough land so that land prices don't go up because of scarcity. But maybe we need to think about affordability differently. Maybe we need to actually think about community housing associations in PSP areas or social housing to structure the affordability. And overall, well, for the transport options or growth areas planning, new approaches are needed, new points of view and new funding approaches. And I think political will is really crucial in that as well. Because you can see, for example, for the suburban rail loop, funding is available. So maybe if we can convince politicians that public transport is essential as well, we'll also get more funding for this. And that was it. Thank you. And I think Robin will take over for.
That's terrific, Annette. Thank you very much. Okay, so that was also perfect timing, I think, 19 minutes instead of 20, perfect. So do we have any questions that occur to people in the audience? If you've got a question for Annette about the project, put your hand up or type something in the chat. I'll just wait for a second for people to think about it. Mark Knudson's put a note in the chat. Do you want to speak to that, Mark, or?
Oh, not necessarily, Robin. It's just that we need to make sure that when you're comparing numbers, we're measuring the same thing. So the 15 dwelling per hectare and the 20 dwelling per hectare, which are planned Melbourne and conventional sort of numbers, are based on developable area. So it takes out things like conservation areas and open space. And in the greenfields, that's been up to 25% of the land. So you immediately see a different set of numbers if you start taking out those sorts of areas out of your assessment process. So just we need to be cautious in that regard.
Sure, and thanks for that, Mark.
Lucy, I'm not sure, is that gross dwellings per hectare? I didn't do the numbers.
Certainly, I mean, the measures we're getting at the moment in greenfields are going in at anything up to 18 to 20 net developable area. Some of the older ones are obviously 10, but anything that's been put in the last 8 or 9 years has been at least 15, if not more. And certainly currently they're going in at up 18 to 20 in some of the precincts. So I'd be surprised if the average was still 10.
Yeah, it's actually, the calculation's a lot more obscure than that in some ways. It's closer to being a net dwelling density because of the way it's calculated. So we have to rely on using areas where there's population to begin with, and also in terms of being able to measure the built environment itself, we were using areas where there were existing streets. So in a sense, we've taken out some of those things where people can't be, which is the parks and the open spaces and some of those people. So it's actually closer to a net dwelling density calculation, not a gross dwelling density. Yeah.
But maybe to add to that, as I said before, one reason that it's relatively low might also be that some of the PSP areas might not have been completely built. So higher densities will be added, and then maybe they will end up at 15 dwellings per hectare. So we have to take that into account as well.
Sure.
Okay.
Now, we've got a question from Stephanie, just simply, when will we have the costings released?
When we've completed them. So at the moment, what we've done, so the project's been looking at, when we look at active transport, we've been looking at walking, cycling, and then public transport. And at the moment, we've done the cost component for the walking infrastructure, which we've gone through previously in some of our advisory groups. We've also now completed some of the costing for the cycling infrastructure, and we're now turning our attention to public transport. So the costings, in terms of your actual question of when we'll be releasing them, will probably be more likely to be next year. The bigger I'm trying to think of the right expression. The bigger nut to crack is working on the benefits, and we've been working through different ways of calculating benefits, and that's a key component of this as well.
Thanks, Lucy. Now, Ellie's asking, what have we learned from the COVID-19 in terms of pop-up active transport infrastructure? That's been mostly in a city, not sure if it's been extended to newer suburbs and areas. Pop-up style infrastructure could be an option, but is it acceptable to local residents? Who would like to answer that?
Well, maybe I'll start. And I mean, in a way, you could probably say that active transport infrastructure is already pretty good in the growth suburbs, or at least in the new PSP areas where there are cycle roads or shared paths. So I'm not, in that sense, sure to what extent it would be needed in those suburbs. And yeah, I have to say, I'm not sure what has happened. So I haven't heard anything, but that doesn't mean it doesn't exist. But I think, especially with active transport infrastructure, and that actually came out in the interviews as well, people are pretty happy with what is there. It's mainly, so at least what is within their suburbs. Sometimes the problem is the connectivity to actually get to other places from their suburbs. So crossing the big arterial roads, that's maybe the problem. But otherwise, I think, in a way, this pop-up infrastructure is not that much needed as it is maybe here.
Okay, now we've got a hand up from Ben Rossiter. Ben, do you want to
Yeah, just a quick question. I think Annette might have just answered that. I was going to talk about good to hear you're finding footpaths, but probably the biggest issue in terms of walking for transport and recreation is crossing things like arterials. So it's not the good things, it's the bad things, in that, the walking route's only as good as its worst barriers, and arterials are the main barriers often. So I'm just wondering if there's any comment on that, because sometimes I sort of feel we say we've got footpaths, all's well and good, but it's often not.
Yeah, and I completely agree. So as I said, that was really the thing which came out in the interviews, with some nice comments like, well, it's nice that we have 5 kilometers of cycle path here, but where do they lead to? So I think, in a way, again, those crossings might come later, but sometimes they are not there. They're in the early stages, so that's a problem in that sense. And for our transport scenarios, we have tried to put those in as well. So we have put in crossings, and yeah.
I just add, and it's also informal crossings, and that opportunities, and that often relates to speed. So it's not just the formal crossings, but it's the distance between the informal crossings and the speed of traffic, particularly on the arterials. So the can be part of that overarching barrier. But that's just a comment. Thanks.
Thanks, Ben. Okay, Teresa Maguire, who's one of our project partners, has got her hand up. Teresa, over to you.
You're on mute, Teresa.
So I actually checked to see if my camera was on, but I didn't look at the microphone. Thank you for pointing that out. Thank you, Annette, for that. We have been involved in the project for the last few years, and but it is always a summary of the findings and just a bit of a refresher. Just a point on what Mark said earlier around the densities. Just a thought was that another reason they might appear low at the moment is that often the housing type that's delivered early in the growth areas is detached single dwellings, and that's because it's the first thing to take place on the site. We wouldn't ordinarily deliver high density living until there is that amenity that we're talking to on the site, and that amenity follows population. So it might be that there's still more high density developments to happen. That's a sort of separate issue. Delivering high densities in growth areas is problematic because of things like council requirements for bin collection and body corporate and all of that stuff. If you were to do a body corporate style development, it is more difficult to do. But that was just a point. And just a thought around the funding mechanisms. I quite like that table. I've seen it a few times now, Annette, and I think it's finally looking like it really makes sense to me. I think just an opportunity, and it just sort of stands out in my mind because I sort of deal with it almost daily, is the contribution that we make to GAIC, which is significant. So, for example, on a project that we've got in Calcalo, we've already contributed $25 million of GAIC on that project over the last 5 years of development. And for so many issues, there's so many reasons that's we haven't seen, well, aside from a big project that Mark and I are working on, which is the freeway interchange delivery, things like bus services, which has just come about. But other than that, it's really hard to sort of, and land transfers, so for school sites that works. But it is difficult to see that money being spent on big ticket public transport, things like train stations and and that kind of thing, and services. And that's sort of where we're trying to get to. And perhaps it's worth looking into that a little bit more, and in terms of how do we actually get better use of the money that is sitting there at the moment.
And maybe just to comment on that, there is actually, in a way, some people think it would be good to spend that money on big public transport infrastructure. Other people say, well, maybe spend it on the little game changers, so rather a smaller project. And then
what it is, just spend it.
So
to be spent either way. I think you have to set for any kind of project to be delivered with those funds. But I think there's lots of sort of internal to government things that are sort of stopping that being spent freely.
Yeah, and I couldn't go into detail today. Maybe I should mention that we'll have this. We have the funding options working paper, which will be finalized in the next few weeks. So if anyone is interested, they could just let me know, and we can send it out. So just to add that.
If you're not, if you wouldn't be receiving it otherwise, put your details or put a note in the chat and we can follow up with that. We've had a bit of discussion in the chat, but I don't think there's any more questions at this point. So I might ask Lucy, seeing as she's on screen. Lucy and Belen and Alan are going to do the next presentation on the health impact. I'll hand it over to you, Lucy.
Thanks, Robin. And I'd also just like to say that we've got Alan helping us, not so much with the presentation, but actually with any comments that come through. But I'd like to acknowledge his contribution at this point because he's done a terrific job in helping us with this work. So I'd like to just say thank you and welcome you all to our presentation, which is looking at health impact assessment of transport initiatives. And I'd also like to acknowledge the traditional owners of the land and the elders past, present and emerging. Just a quick overview with our project. I'm going to give a very quick overview about the project. I'm going to talk a little bit about what a health impact assessment is so that you all have a broad overview of what they are and why it's important. I hope you don't see all these notifications coming up. I'll also, at this point, hand over to Belen, who will talk about a bit of the background and a framework for this work. And she's going to take you through an example, first looking at the built environment and then looking at a transport application, and in particular looking at it as a pro forma for a health impact assessment tool, which we're going to be releasing through the Australian Urban Observatory. So with this project, I'd first like to start by acknowledging the RMIT Enabling Capability Platform Opportunity Fund, which has provided a lot of support for this particular project. And I'd also like to acknowledge our partners with this project, which is the Victorian Department of Transport. And you can see that we have quite an extensive team, and I'm particularly grateful to the Department of Transport team because they've really brought this project to life with the work that they've done with some of the transport modelling. In terms of the project and its focus, it's really measuring health impacts of active transport. But I wanted to just draw your attention to this idea that academics tend to focus on active transport in terms of walking and cycling initially. And that's because they have a very obvious and strong physical activity component. But it's also the case that there's a physical activity component that is linked to the use of buses, trams and trains, because most people need to, many people, not all people, many people walk to the bus, train or tram stop in order to access public transport. So in this project, and with the help of the Department of Transport, we've been trying to look at the physical activity component of people accessing public transport. So I wanted to go through that's important. The reason the physical activity component is quite important is that it's a modifiable risk factor for our health, and perhaps it's quite obvious for us at the moment where we've had to change our behaviours quite radically. But physical activity is something that has some very obvious health benefits, but particularly in terms of chronic diseases, and it is something that we can tangibly measure. And in being able to measure it, we can include those measures of the health benefit into economic appraisal. At the moment, there's a lot of information out there about cost benefit analyses, and it's the cost component that's relatively easy to measure in some ways if you know what the quantity of something is. If it's tangible and has a cost, you can measure what that is. But when you're looking at the benefits, some of those benefits are much, much harder to measure. And unfortunately, health is one of them. But what we have at the moment here is a tool that can do that, and that's what we're sort of presenting to you at the moment. Now, the reason that's quite important is that if we can measure health, we can provide that as a form of evidence to help balance that equation. Sorry. These notifications keep coming up. So in terms of creating evidence for decisions, it's good to be able to measure the benefits of health. And in doing so, we can influence the way we plan and build sustainable cities, but we can also influence the health and well-being of residents by the way we plan and build cities. So there's a flow-on effect for getting this right, but the first step is to get the plan right, and we really need the right kind of evidence for those decisions to be made. So that's a little bit about what this project is really seeking to do. It's to provide the right kind of evidence in terms of what the health impacts are of these big projects. So a health impact assessment very broadly is defined by the World Health Organization as a means of assessing the health impacts of policies, plans and projects in diverse economic sectors using quantitative, qualitative and participatory techniques. I'd just like to draw your attention to those words that are underlined, and I'll come back to what we mean by health impacts later on, and Belen will go into that into some detail as well. But also in terms of the policies, plans and projects, what this really means is what we're planning to do in our city. Some good examples of that would be Metro Tunnel, major infrastructure projects related to transport are some obvious ones. And the reason they're important is it's often the case that it's the sectors other than health that actually have the biggest influence on health. In terms of policies, it can be a range of different policies that can have health impacts. One that comes to mind that perhaps is just an easy one is the lockout laws in Sydney. They were invoked for a variety of reasons, but really health impact was part of it. In terms of health, or rather, I was about to say that for this project, we're looking at a quantitative health impact assessment tool, and we're focusing on that quantitative aspect of how we measure health impacts in general. But in terms of health itself, it is defined as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And the reason there's a high-level definition of health is it allows the people who are the stakeholders to the health impact assessment, the people who are driving that process of understanding the health impact of a policy or a plan or a project, they can for those people who are involved in a health impact assessment, they can define what the most important and pertinent health impacts are. So at this point, I'm going to hand it over to Belen, who's going to continue with the presentation to give a bit more of the framework and the background of the work that we're doing.
Thank you, Lucy. You just take control. Thanks, Lucy, and welcome everyone. So now I'm going to go in a bit more of the details around the framework that we use for our work, and a couple of examples, finishing with the current work that we are doing on developing a tool for the Australian Urban Observatory. So it is now well recognized that there is a relationship between the built environment, transport behavior, and health. And health in this framework is represented by mobility, which really represents whether we are sick or have injuries, and mortality, specifically premature mortality. And the message here is that if we want to change health, we have to change the built environment. Here, the built environment is characterized by the Ds. We have 6 Ds that were initially proposed by Edwin and Severo, but it's just a way of grouping characteristics of the built environment for analysis. And now there is a lot of evidence that shows that these characteristics, so for better, might positively influence walking and cycling, but also for the worse, might encourage car use as well. There is also evidence for public transport in this original study by Edwin and Severo. Now, our transport behavior impacts on our exposure to risk factors. So risk factor is something that can be beneficial or can be detrimental to our health. Here we have physical activity, air pollution, noise, and road injuries. And these are listed here because we have now quite robust evidence that shows that transport behavior is related to them. So for example, and this is an obvious one, if we walk or cycle for transport purposes, we might be more likely to meet the physical activity guidelines. There is very robust evidence that shows that these risk exposures here are related to morbidity and mortality. For example, physical activity is causally associated with developing non-communicable diseases such as cancers, cardiovascular diseases, and diabetes. but also would die more prematurely. In what follows, I will show you some stats for each of these elements of the framework, with the aim of highlighting that we really have an opportunity to improve the built environment and behavior to achieve better population health. Starting with the built environment, here I'm citing the Liveability study conducted by our group, where they assess policy targets. So they search for policy targets for different aspects of the built environment, and then they measure on the ground the proportion of suburbs that were achieving these targets. They did this study across Australia. Here I'm giving you the example for Melbourne. For example, one of the policies says that in between 80 and 90% of residential lots should be within 1 kilometre of an activity centre. When that's measured on the ground, only 11% of the suburbs in Melbourne meet that target. Another one is dwelling density, and that's 15 dwellings per hectare, and only 23% meet this target. There are also targets for distance to transit and access to public open spaces, and the percentage of neighbourhoods meeting them is quite low as well. Now, when we look into transport behaviour, in Melbourne, like in most Australian cities, people drive the car a lot. So 63% of the trips measured at the state level are by car, over 1/4 by walking, 8.4% public transport, and a very small 1% cycling. Now, when we look into these modes by distance category, pretty clear that people drive for very short distances. So here at the middle figure, in between 1 and 2 kilometers, we have that 52% of people drive for that distance, and the distance between 3 and 5 kilometers, 80%. If the conditions are suitable in terms of infrastructure, people could walk or cycle these distances. Second last, in terms of risk factors, in Australia, we have a high prevalence of physical inactivity. So for those who don't know, the guidelines say that we should do 150 minutes of moderate physical activity and at least or the equivalent of 75 minutes of vigorous physical activity, and do two sessions of strength per week if we are in between 18 and 64, or if we are 64, 30 minutes of moderate physical activity per week. When that's measured for Victoria, nearly 50% of the population meets the guidelines. Another issue related to risk exposures from this framework is road injuries. And pedestrians, and cyclists are very vulnerable in comparison to car drivers. For example, the death rate per 10 million kilometers traveled for cyclists is 4 times higher than those who drive or are car passengers, and 12 times higher for pedestrians. For the case of serious injuries, the rate is 7 times higher for cyclists and 8 times higher for pedestrians. These figures are a bit old, they're from 2010. Lastly, when we look at the morbidity and mortality component, we use a measure to combine both of them called the DALY, which is the Disability Adjusted Life Year, which tells us information about premature mortality, so people dying before their expected life expectancy, and people suffering from diseases and injury. Looking at physical inactivity and one disease here, type 2 diabetes, we have that in Australia, 19% of the burden, so the DALYs attributable, of diabetes are attributable to physical inactivity. This means that if we eliminate physical inactivity, we would be avoiding 19% of the burden of type 2 diabetes. And this concludes with this framework just to show how we can go from the built environment to health. Now, very briefly, I will outline the methods that we use for our work to simulate the health impacts of built environment interventions. In this framework here, I'm showing you an example of a shift from the private car to walking and cycling, which could turn into a change in physical activity. Now, it's important to note here that we have been assuming that when people shift from car driving to walking and cycling, their physical activity levels increase and there is no replacement with their recreational activity. And this is because we don't have enough evidence about this yet. Now, physical activity is causally associated with a range of diseases, as I mentioned before, cardiovascular, some type of cancers, type 2 diabetes, and we have more evidence now coming for mental health outcomes. We summarize this information and use it in a model that's called a proportional root-state life table. Very briefly, what we do in our model is we look at a population today and we follow them over time. And what happens to that population is that they change their levels of physical activity because of a change in the transport behavior or a change in the built environment. From that modeling, we can estimate outcomes such as life years. So life years is, we all contribute every year to a life year. So a calendar year of us living, it's a life year. Now, our life year might not be in full health because we have diseases or injuries. So we adjust them for that and calculate health-adjusted life years. We also can calculate life expectancy, health-adjusted life expectancies, and changes in death and number of new cases, so incident cases of the model diseases. In one application of this framework, in which we look directly at the built environment, we assess the physical activity-related health and economic benefits of building walkable neighborhoods. And in this study, we compare a brownfield development with a greenfield development. Our case studies were here in Melbourne, so Altoona North, or Precinct 15, and Truganina South. We used the built environment characteristics of each case study to explore. First, what was the probability of walking in each of these developments, given the built environment characteristics the residents are exposed to? And then we use our proportional root-state life table simulation approach to estimate health-adjusted life years and economic value. We use two main tools for this, as I said, well, here we call it QHIA, Quantitative Health Impact Assessment Model, but it's what I just explained to you before, and a planning support system, which really gave us the probability of transport walking according to the exposure to the building. This figure here just depicts the two sites chosen for analysis, and on the top right, or my right, we have the CBD and Altoona North closer to the CBD and Truganina further out. The blue color in the figures is the proposed development area. Then the pink dots are the local living destinations, so places that we go every day for our local living, such as supermarkets, banks, post office. And the green spaces are public open spaces. And then we have in the very light purple the bus lines. When we compare these two sites, and here we have Altoona North developed, so with the proposed development, and Truganina. One thing we observed was that gross student per hectare was 9.1 in Altoona North in comparison to 3.5 in Truganina. The number of intersections, 54 in comparison to 33. Now, intersections are important for connectivity, for getting from A to B, and the literature supports that they support walking and cycling. Then in Altoona North, residents had access to a training station within 100 meters, but they don't in Truganina. And in both sites, they have access to a bus stop within 400 meters. In terms of local living destinations, in Altoona North, people have 11 local living destinations in comparison to 8 in Truganina. When we model this and look at the probability of walking, the probability of walking of people in Altoona North is 48% in comparison to 26% in Truganina. And I should clarify, this is walking for transport purposes. When we use this information in our health simulation model, we found that if we shift those people living in Truganina to Altona North, we would gain 1 month leave with full quality of life per resident. So that's one health equivalent to health adjusted life years, and an economic value of 4,500 per person with baseline year 2016. Now moving into the work that we're doing now into this space. So with Alan Both and Lucy, we have been developing a health impact assessment tool that will be accessible in the Australian Urban Observatory. This model follows the proportion stay life table model that I presented to you before briefly, and also some work that I have been doing with colleagues in the UK in other projects called ISM and NetaHit. This model will be based on Victorian data. It will be user-friendly, free to access, and we plan to launch it by March next year. The model will have a few options for the users. So the users can choose what sex or age to model, or if they want to model them all. And the main, one of the main inputs is what distance to replace, with walking or with cycling. And these distances are mutually exclusive. And then what trip purposes the user wants to replace. We did a bit of an extreme example here where just a very preliminary result, where we'll replace trips under 2 kilometers by car with walking, and trips between 3 and 5 kilometers by car with cycling for all ages, genders, and trip purposes. As we observe in this graph here, there is a sharp decrease in car trips from 63% to 35%, an increase in walking trips from 27% to 38%, and a very sharp increase in cycling trips from 1.3% to 18%. When we look at the potential health outcomes of achieving this shift in modes, we found significant gains. This graph here shows the avoided death for the model diseases. From top to bottom, we model breast cancer, colon cancer, type 2 diabetes, ischemic heart disease, stroke, lung cancer, and uterine cancer. On the x-axis, we have the simulation year. We model a closed group of people, so the people that we observe today, we move them into the future until everyone dies, and we change the levels of physical activity because of the intervention. The greatest gains are for cardiovascular diseases, so ischemic heart disease and stroke in the fourth graph and fifth graph from top to bottom. And the gains accrue quite far in the future, in about year 60 of the simulation. Towards the end of the simulation, we have no gains because people die. The model also assumes that people will die at age 100 if they don't die before. The same similar graph for incidence. However, for incidence, so incidence the new cases of diseases avoided, the gains are much earlier because people first need to get the disease and then they might die from the disease. And what it's important with incidence is that if people don't get the disease in the first place, then they're not a prevalent case. So avoiding cases of disease is very important from a healthcare cost perspective and for the individual, so they don't live with morbid states. The greatest gains here are from diabetes, followed by cardiovascular diseases. So to sum up, health is important to measure. And with our work, what we aim to do is to provide research evidence that supports decision-making and improvements to policy. And as expected outcomes of including health, we would expect that cities and neighborhoods will be well planned, sustainable, healthy, and we will end up with functional cities. Thank you.
Thank you very much, Belen. That's terrific. Now, have we got any questions for Belen?
And Lucy and Alan.
Or Lucy or Alan, exactly. Any questions on the work? There's been a few, a bit of chat in the comment, but just wait and see if anybody's going to put their hands up. Well, that's fine. We can let you think about that for a little while, and if there's no questions, we can move on to the next presentation and have more time at the end. Meanwhile, you can be thinking about morbidity and mortality and how you really should get out and walk more. Okay, so perhaps I'll ask Melanie now to come up for her presentation.
Thanks, Robin. I am just loading up some slides.
Sorry, I don't want to rush you, Mel.
No problem. Okay, are they up?
They are. Good on you.
I'm going to take Belen's lead here, and I like the idea of turning your camera off so that you can actually see what's going on. So I'll do that. Thanks, Robin. I will get started then, and also acknowledge that I am sitting on Wadawurrung land of the people of the Eastern Kulin Nation, and their unceded land, I should say, and I acknowledge all elders past, present and future. I have a perfect segue from Belen to talk today about the Australian Urban Observatory, and this may show some of the intersections between a number of the projects you've already heard about today. And you might be wondering, if you haven't seen or heard anything about the observatory, what this thing is, given all the mentions so far. So let me kick off. Always one slide. There we go. Okay, in terms of the observatory, really I just want to set the scene of the framework and where this connects in. So in terms of the indicators, we provide a range in the Australian Urban Observatory, but indicators and use of data is easy to do. The harder part, I believe, to go with it is to understand what is the conceptual understanding or the theory that guides the use and dissemination of those data. And really, this comes back to a key definition of livability, which we created as a team of researchers back in around 2012, where we came together to come up with the definition you see on screen. And this is a really comprehensive definition, but also really important because, to my mind, I think this is something that makes sense to people in general. It's not just something that makes sense to us in terms of academic research, but also in terms of where people want to live and how they live their lives. So you can see we would say it's a safe, socially cohesive and inclusive place. It needs to be environmentally sustainable with affordable and diverse housing linked via public transport, walking and cycling infrastructure, to employment, education, public open space, local shops, health and community services, and leisure and cultural opportunities. So there's a lot of things in there, but absolutely these are really central to livability as we understand it. So just keep that in mind as I go through and present today. So why is livability important? And I think one of the essential things to think about here too is this idea that you hear, say, the Economic Intelligence Unit or other organisations really talking about livability but not defining it. So the unique thing that I would argue we're providing, pardon me, is that definition of livability, but more importantly, a connection, because you can see this famous little model on the screen from Barton and Grant, and it really talks about how our health is determined by where we live. So in terms of health understanding, we would say these are the determinants of health, but really where you're born, where you live, where you work, where you play, where you age, all of these factors are really essential to determining your long-term health outcomes. And as Belen mentioned, and Lucy before her, and Annette before her again, that transport is a key determinant of health. But when we think about transport, we don't think of that connection to health so well. And you can see here the places where we live and the way we design them, how we build them. These are essential to those long-term health outcomes. So for us, there we go, directly relating that social determinants of health, connecting health to planning, because of that connection between where we are, what's around us, and how that may influence our lives, and the ability to be active, particularly in terms of the use of transport. Livability indicators link research evidence to health, urban design, and policy. So the idea with an indicator as well is not just to produce a number because we think it's interesting, but to ensure that all indicators that are created have that policy lever connected to them. So we want to understand what's happening, we want to measure and monitor, but we also want to make sure that it's got that connection to policy lever so that it could influence, if need be, to create change. So why indicators? And I've brought this slide up here because in a past paper we've written about this, but thinking about indicators as icebergs, as I would describe them. They don't do everything, but what they do is act as that tip of the iceberg to tell us what's happening. They really direct attention and to engage people. Most importantly, what people don't often talk about when they're thinking about the use of indicators and data is the importance of supporting participatory and deliberate democracy. So yes, we want people to see these indicators, we want people to engage with this data, we want people to really sort of think about what's happening in their place. So it's really got a broad audience in terms of trying to capture interest in understanding what's around people, who's living in a community, what's happening in that community, what these places look like, and also sharing it. So they're advocacy tools in that sense as well. They're not unbiased because we're creating them, connecting them back to that understanding of the connection between the social determinants of health and urban planning. But I would say we're trying to use that bias for good to really highlight those issues that deserve that time and attention to be looked at, to be monitored, to be understood. There's inclusion of a range of perspectives in development, application, dissemination in urban governance. So this is really important too, that in terms of the development of indicators and those that you will see in the Urban Observatory, they're shaped not just by the understanding of research and research translation, but also the understanding of the needs of the practitioner. So for us, it really is the ability to try and to be working with partners and understand those key issues, or the hot issues as I would talk about them, and to engage that back into the research findings and the research knowledge. So it's not just research going out, it's trying to combine both factors together. Indicators are conversation starters. They really do link community engagement, policy, research and practice and back again. So that was that process I was just talking about. And essentially they have been designed for tools for policy, in terms of being able to understand what is happening on the ground and making sure a measure is connected to something that is relevant to policy, but also to monitor and report across time so that we can see where progress is being made. And I guess not being afraid of seeing some negative results. That's okay. To me, there's nothing bad with a negative result. It's really trying to understand that negative result, where it is, so you can intervene to improve it. But the monitoring and the measuring comes in there so you can see those changes and improvements across time, but also some more supporting democracy. So that citizen engagement aspect can't be lost from this. And I guess in terms of the role of different organisations, it's sharing that information back out. So what is the observatory? The way to describe it is it's a digital, I would say, livability planning platform, transforming complex urban data that we start with. We spatially analyse it, we connect it back to an address, and then we try and map it and make it easy to understand in livability indicators for 21 cities across Australia. In Australia, really, we're looking at, in Victoria, it's all the local government areas of Melbourne, as well as Bendigo, Ballarat, Geelong, and also Albury-Wodonga. And we go right down, not just to the LGA, but to the suburb and the neighbourhood level. We're trying to really promote observation and understanding of important social, economic and environmental issues. So people who aren't familiar might say, what is an indicator? I would say it's an aggregated or abbreviated measure that can take something very complex, connect it down to a place and report on something including those key social, economic and environmental issues. We're really trying to take some complex information and make it easy to understand. So we would argue that the AUO, or the Urban Observatory, is trying to make it easier to understand, one, a definition of what livability is, but then interpret those results. You don't have to be a mathematical or spatial whiz to be able to go through and understand this. It's really using data visualization at the key to make it easy to understand these issues. And most importantly, is trying to make the research that we're producing useful. So instead of us just doing our own work as academics, as you can hear from all the partners and my fellow colleagues involved today, we all have passion to make research useful and connect it back into practice. So this is a key way for us to make a tool, and there's many factors that have come in here in terms of research knowledge that become incorporated and then translated back out. And the health impact assessment model is one of those. In terms of the value, why should you care? What is the value of the observatory? We would say that these are livability indicators designed to inform policy planning and practice. It's not just for the research sake, it's actually to try and make it easier to incorporate research and research evidence into everyday practice. Most importantly, we're trying to encourage effective policy outcomes. People work very hard in their work to try and create change and produce interventions over time. But one of the key things in terms of that work is being able to take time out to look at where should the interventions go, and are these interventions making a difference? Because if we keep doing the same things and it's not producing an outcome, then that's perhaps the not best use of time or financial resource. We really want to help to evaluate and monitor policy outcomes over time, so that if we can make those grand aims that we'd want to achieve something, we don't know if we've achieved them if we don't go back and actually evaluate. But most importantly, save money, time and people resources. The work I'm going to present is actually up to 8 years of research that's gone into the production of these indicators, and then more time to produce the digital platform that it sits within. So it's taken a lot of time for us to put it together, but most importantly, we don't want people to go ahead and have to employ people to go and do data work that we've perhaps already done, and we can make it easy to use. We also obviously want to support the community engagement. So I guess in terms of the production of the results and looking at the indicators, we want them to support engagement with the community and the creation of community vision. So it's both policymakers, planners coming together with the people who live there and producing that great vision. So this photo here has many smiling faces, and actually is an acknowledgement to all the people who have produced the indicators included in the Australian Urban Observatory. So many thanks to all of them. And also on top of that, I've just overlaid a team of people who have been central to the production of the digital platform itself. And Alan Both is in there and on the call with us today, and Lucy Gunn in the corner. So we have been working on this for a number of years, and really started working on the observatory when we moved to RMIT in 2017. So this is over 3 years of working, even just producing the digital platform itself. What's included? We have a livability index, a walkability index, social infrastructure, transport, food, alcohol, public open space, employment, and housing. So these are really the key domains of livability that we've measured and mapped to date, and we do have plans to do more of these into the future. One of the questions I do get asked sometimes is about why the inclusion of alcohol, and this really connects in with the Prevention Partnership Centre, the National Prevention and Partnership Centre, funded by the National Health and Medical Research Council. And we have been producing that because we want to look at some of those associations between where these factors are in the built environment too. The Livability Index and the Social Infrastructure Index are the two main indices included in there in the Australian Urban Observatory, and are freely available for everyone to look at right down to the neighbourhood level. The others are actually available at the local government area level, but then restricted at the suburb and neighbourhood level unless somebody becomes a funding partner with the Australian Urban Observatory. The idea being that we want to create sustainability in the production of these indicators so that the AUO is around for a long time to come. Because I know from past experience, one of the true value of the use of indicators is not a one-off period of time, it's a longitudinal. So we're actually planning to increase what's available at the moment, but then increase time series availability of those indicators as we grow. Observation, understanding and action. These are really the key themes that come out of our work. So as I mentioned, we have access to suburb and neighbourhood indicators for the first time for Australian cities. Made easy to use, easy to see, and really to support the development and evaluation of effective policy. So this is what it looks like. If you log on to auo.org.au, this is what you'll see. And you can see on the web page, there's a number of menus up there. And what we are hoping, we're going to add an extra one and around early next year, and we'll have a health impact assessment model tool. And that is the work that Belen has previously spoken about. And we'll actually have a demonstrator so people can go in there and look at health impact assessment and start using the model themselves. That will be available to anyone who comes to the site. So once you come onto the front page, if you want to look at the mapped results, you need to register, and then you go through to the mapping page. And I'm going to give you some screenshots here just for the sake of time to see what it looks like when you get inside. So here's an example of the Liveability Index, and you can see I've started here with the City of Melbourne, and we've got local government area data available. When you look at this, you get the sense that yes, maybe you're doing a little better in the inner areas of Melbourne and not so great in terms of the outer areas. But that's well and great when you've aggregated across an LGA. But what we really want to know is the intracity difference, not the intercity differences here. So it's not that I'm so interested in comparing Melbourne to Sydney, Sydney to Canberra, whatever it may be. We're really interested in what's happening inside the city, so we can design those areas that need the greatest point of intervention. So going down again, we're going to go down from an LGA, and you can see it circled across the side there, and the Liveability Index is highlighted as the actual indicator produced here on screen. Going down to the next slide, we can see we've now moved to suburb. Just to go back up, LGA, back down to suburb. You can start to see we're getting more variation here. And this really is to make the point that not everywhere on the outer is doing badly and not everywhere on the inner is doing great. But this is at suburb level, so we're getting a little bit finer. We can move down again, and I've moved down now to what we call an SA1, which is a statistical area level 1, or the neighbourhood level. So we refer to those most detailed, it's actually Australian Standard Geography, this SA1 that the census also is collecting the data on, or the ABS uses as their standard geography. So this is really small, around 400 people in a neighbourhood. And you can see we've got SA1 circled on the screen, and underneath that summary scale circled information, you can see there's one little tiny area that's been circled. And I've highlighted on that because when you click on it, it comes up with this scorecard result. And you can see here that I've actually clicked an area just as a demonstrator of Vermont. And you can see there that the livability score for this one particular neighbourhood is 97.9. Now I know that when we talk about the livability index, the score is like a balanced scorecard approach in how it's calculated. 100, like an IQ score, is about average. Anything under 100 would be below average. Anything above would be above average. So you can see here, livability is not bad in this particular area or neighbourhood, but it's also a little lower than 100. If you go down again on that right-hand side, you can see the scorecard in terms of the individual domains and some of the indicators included. And that really is telling us some of those results in terms of walkability, social infrastructure, public open space access, local employment, housing affordability, stress. So talking about a number of those key issues, and we can see just an example here that local employment is quite low in this area and gives you some sense of where you might want to look further in terms of all the other indicators we have available. At the moment, we have 34 separate measures for all of those domains, so people can go in and click on them. You can go in at any point and look at all of those different indicators by just clicking down the drop-down box where you can see the livability index is listed in the top right-hand corner. Also down further, you can see we have some ABS statistics. So in those ABS census data, you can see there's a number that goes down further in the page. Now, I'm just going to give you a couple of final results that relate to this work, and you can see the connection again. So in terms of this next slide, this is access to activity centres, again at the neighbourhood level, but this time as a demonstrator, I've selected Truganina. So in terms of that one little area, you might see there's a little green square over on the left of the in Wyndham, and you can see I've selected that area, but I've changed the indicator that's included and presented on screen this time to average distance to closest activity centre. So you will have seen in Belen's previous presentation, she talked about some of those key factors that we know are really important in terms of transport and health that connect to those social determinants of health, but importantly planning. So we have destinations, so what's access to local destinations, dwelling densities, distance to public transport, distance to public open space. All of those indicators we have available down to this SA1 or neighbourhood level in the Australian Urban Observatory. So people can get a spatial representation of what's happening in this particular area. And it may then, like that iceberg, the slide I showed you earlier, the image, the diagram, it gives you that sense of what's happening here and do we need to go further to understand what's going on in this area. So indicators don't tell you everything, but they're definitely directing attention and making it much easier to look at the results for a particular area and where intervention might be required without having to go through pages and pages of data in tables. This is really making it faster to understand where it's going. So you can see on that particular neighbourhood that I've selected in Truganina, the result here in the green box, the aqua box on the left-hand side, the average distance for this particular neighbourhood to an activity centre is over 4 kilometres. Now, looking at the results and the research presented earlier, we know that most people won't walk further than about 800 to a kilometre, 800 metres to a kilometre. So this is a big distance, just to give you the idea. Next one is dwellings within 1 kilometre of supermarkets. Again, this is at the neighbourhood level. I've just picked another area out there, not dissimilar to the previous one, because we know that supermarkets are very associated with activity centres. And we can see here, in terms of that percentage of dwellings within a kilometre, it's 0 because we had the 4 kilometre distance to activity centres. So you get the picture, but you can see also in that area across Wyndham that there's a number of activity centres that are poking up. And you can see those, but you can also see those outer areas where they're not having access to that distance, which is really important in terms to living an active lifestyle and the connection to transport again. Finally, I've moved across now to the southeast, and this is an example percentage of dwellings within 400 metres of public transport with regular service. That's every 30 minutes. Now that's pretty hard to get in a lot of areas of Melbourne, and I've just chosen this one area, which is in Berwick, within the local government area of GAIC, and you can see there's a real patchwork in terms of results. But there's a lot of pink happening on this map, which is telling us that not a lot of people have access to any form of transport that's regular across these outer areas. And that's really important to see. That's my final slide to show you. As I said, we have over 34 indicators, so I could go through these and keep presenting and playing for a long period of time. And I would gratefully, take any questions later on. But before I head to questions, I actually have some questions for you. So now I'm just going to move through in this final session, hold any questions you may have about the observatory, and I'd like to present some questions about what you've seen today. So I'm going to move on, and please get your phones out while you're sitting on your screen, because I'm going to get you active in some small way. And I want you to have a look at the screen now. And please pull out your phone, and if you can just put your camera onto that QR code in the corner, it will take you through to Slido, where I would ask you to get interactive here and tell us a little bit more about what you would want to know. We've done a lot of talking to you, but now we'd like to learn from you. What do you think is the biggest issue in the early delivery of transport options in new suburbs? Okay, we've got an answer. It works. It's always exciting when technology works. Please put in any issues you might have here. This is just an open forum for people to put in anything. We can't see who you are, so you've got freedom. Go for it. Be bold. Great coming up. Funding. Funding's going to be loud. We know that. Great to see. You'll see, you would be interested that we have density measures, we have walkability measures in the Australian Urban Observatory too. Yeah, it's good to touch on some of these. Political will, that's a great one. Some things are harder to measure. Okay, we've got 22. There's some of you who are feeling like you'll just sit back and watch. Go for it. Put in anything else you can think of. Be brave. I can see here too some of the things that keep coming up for us. Multi-stage developments, which goes to funding in some strange way too. Yeah, think of some of those things that are harder to quantify too. I think this is really important. Some things we can measure and get answers. Others are much harder to measure. Delays. You can see the early delivery aspect that we're talking about too. And the frightening thing is, now since COVID, we had a lot of people moving, a lot of people active. Now we've got a lot of talk about people wanting to go back to cars and encouraging the use of cars, which is frightening. Okay, if we get one more, that should be at least half of you have contributed. Fantastic. Okay, I've got another one. These are hard ones I've started with because I've got you to think openly. I've got some restricted ones that are much easier to answer. Okay, I'll move through. These should stay open, so if you still have ideas, go for it. This is the next question. Do you think health and wellbeing should be formally incorporated in transport assessment? There's got to be one person out there who's going to disagree, surely. Okay, so we can see most people are supporting this. I told you they get easier. Yes and no means less effort for your brains in the afternoon. See, as I start to see the no's increase, this is the problem with multiple choice questions. I start to want more, want to know those reasons, which are harder. We can bring this into the Q&A too. So please use these as some of those things to prompt questions that you might have for everyone who's presented today. We have a few dissenters, so that's interesting to see. I call you dissenters because obviously I'm biased. Are you interested? Next question. Are you interested in using a tool to quantify health impacts of transport in your practice, whatever that may be, whatever you're doing in your work? And I've been kind here. I've given you the maybe option, which as somebody who has quantitative analysis, survey design experience, I try and avoid, but I'm being gentle for you in the afternoon. And this again may be some of those things. Some of you who are putting maybes or no, you know, we're open to this. This is part of having these forums, is really to learn from everyone, is about why the maybe or why the no. Why the yeses too? Because there's many ways that you could use it. And it may be for actual you doing the work, it may be in an advocacy, it may be in a communication, it may be in an organisational situation. So think about some of those. Okay, we can see a gradual drop, so we better keep going. After today's session, what topics would you like to learn more about? Is there anything? You may have nothing to say. You might say, I've learned everything now. But using this next question, is there anything you'd like to hear more about? And don't feel compelled on this one, but if something you've heard a bit about and you are interested in, please let us know. Okay. Benefit, I'm sure that was a benefit to health costs. Linked to this would be great to further understand. So maybe that is some of the takeaway message for us, is to share some more information with you, and perhaps we could use the registration list to send out some further information for those who are interested. Joint advocacy opportunities. Well, I can only speak on behalf of myself here, but in terms of the Urban Observatory, we would love to support any advocacy opportunities, and I'm sure the rest of the research team would. I think one of the good things, I could see something there about government. Look, we're partnering with many types of state, federal, local government. So, and within the health impact assessment work, Department of Transport is interested. And yes, we'd love to brief MAV and VLGA and have been in contact. Yeah. It is fascinating to see them appear. Placement of bus stops. It's a good one. What indexes will be targeting inclusion in the development applications? So if you, again, use this, if you're thinking about ideas here and you want to bring them back to Q&A, go for it. I think this is my last question, actually. And you've done really well being able to participate in an afternoon session. So please keep filling them in. But Robin, I might hand back to you at this point, if you'd like to come back.
Terrific. Thanks, Mel. Yes, I'm here.
Oh, we've got one last question.
Oh, okay.
I forgot.
I'll type down for a minute.
Sorry. This is a very last question. I can't count. Obviously thought I was up to 5. This is the last one, and would be great if you can put something in here, because for us, this is always a challenge in terms of disseminating research. What works best? And this is going to be different for different people and different organisations. We all process information in different ways. So please add to this one. And I've warned you now, Robin, so you can get ready. See if we can get a few different answers. I like the one about case studies too, infographics. Try and think. Yeah, I guess one of the things that we're always struggling with too is different ways, whether it's digital media, how we can do things differently, and to make it easy to process big pieces of information in an easy way. But then there's also going to be the role for traditional methods as well. People like case studies. We have been thinking about a video too. Short videos are in there.
Terrific, Mel. Well, maybe that can keep on filling up while I turn to some of the questions. Do you want to leave it up on the screen, or are you taking it down now?
Oh, do you want? I can leave it up.
Well, I don't know if it's too distracting for people, if people are finished.
Yeah, no, I say you go for it, Robin.
Okay, well, look, I might start. Intriguingly, Jerry put in the question in the meeting chat some time ago that she had a question, but didn't say what it is. So I might ask Jerry to relay the question. if you're still on the call and unmute.
Maybe she's gone.
Maybe she's gone. All right, we'll leave that one for the minute. Then the next question was from Nigel. Are there any plans to include tobacco outlet density like done for alcohol?
That's a good question. Probably not at this point of time. The one good thing I can say about tobacco use is that, you know, we have seen great strides ahead in terms of control, but it would be something, one of the things that I know that a lot of people in local government would be really keen to see, and we have the data, we're sitting with it at the moment, is gambling.
Yeah.
But we want to go for the social determinants of health upstream approach, like looking at prevention and promotion rather than the outcomes. So we're trying to avoid them at the moment.
Okay, and then Lucy's put in the chat, I love the goal of this supporting wider engagement and deliberative democracy. What will be the funding access model going forward? And is there a way for supporting broader citizen engagement? E.g., if LHDs or councils subscribe, could residents in their area also access it?
It's a great point. And this is one of the challenges we really face, because the underlying philosophy is that we want to give everything away for nothing and to make it available to everyone as a common good for the whole of society. But we struggle because, as people will appreciate, particularly in this day and age, funding within universities and the research sector is getting tighter and tighter, so that we need to create sustainability. Within the LHDs themselves and what they want to do with that information is definitely up to the LHDs, and I would definitely encourage that. But at this point in time, we need support. You know, we're not talking big costs for a local government to be involved and have access to the observatory. We're only asking for $7,500. So it's quite small at a 12-month kind of funding partnership, or at a state level, it's $50,000. And that really is just to enable us to fund the creation of new indicators and the ongoing creation of longitudinal points for that data as well.
Okay, and on a similar theme, Jackie's asking, with the notion of livability being so individually subjective, how do you determine the livability of a place without consulting the residents who live there?
I would love to consult the residents who live there to really combine the subjective and the objective, and that would be the true goal. But we have to start small. It's taken us more than 3 years to get up, 3.5 years just to get this up with the objective measures. The next thing would really be, and look, if the NHMRC is nice to us, we'll have some possibilities to do some more citizen engagement work. And this is where I think you'll see the real benefits, that we can engage with citizens to understand their perspectives and match it to those objective indicators too.
Then there's a bit of response to the tobacco question. Then Julie makes a comment, and I'll read this out. Says, glad you've added 30-minute service to public transport criterion. The late great Paul Mees used to point out that the level of public transport service has much more to do with mode choice than density. And I wanted to highlight that one in tribute to our friend Paul. Stephanie's just saying thank you very much, which is great.
That 30-minute frequency public transport measure comes from the whole team, was produced, but also is included in the National Cities Performance Framework. So that's where the 21 cities come from that are included, but the Australian government at a federal level are using that indicator themselves. So they might be interested to hear that.
And Jackie's bringing up the issue of gambling, particularly in relation to the damage on young people. I'm not sure if anyone's got a comment on that.
Well, definitely I know that it's really important and that people want it. Within Community Indicators Victoria, for those of you who are around and know about it, it was one of the most popular indicators we also included. But I guess this is where these things are not so easy. You see an indicator result and you go, oh, well, that's not that complex. But the work behind it becomes really complicated, because now we know that online methods of gambling, digital gambling, is probably, particularly during COVID, that's increased substantially. So the methods we had previously about expenditure types and where electronic gambling, you know, the pokies were, those ones perhaps are a little out of date, and we nearly need to think about new methods. And so this was where it goes to, whether it's banking data and so on. It's really complex, but that's an area for the future. If anyone's interested, come and talk to me.
So Ali was also asking about the pokey machine numbers, but Alan's put his hand up. I think you've got a response, Alan, or a comment.
Melanie covered most of it there about the. I guess the reality now is that it's mostly online or on the phone that people seem to be gambling now. I'd also add about the tobacco. So we did look into that, and one of the things we do find is that it's supermarkets and newsagents. They're the ones that they contribute to the bulk of sort of tobaccoist sort of retailers. So. It sort of ends up looking like, because in theory we want to be saying actually having a newsagent and a supermarket near you is quite beneficial, but the drawback there is you can also buy cigarettes, and there's generally a liquor land or something also attached to it. So there's this sort of it's better to have that there, but also it's worse to have that there.
Yeah, and we do have daily living destinations, which would be the sorts of places you go locally for milk or bread. They're included as a separate measure within our walkability indicator, walkability for transport, that is. But also we have access to supermarkets and activity centres. So it gives you some sense if you were to think, you know, using that information that Alan's saying too.
I'm not sure if I've got any more specific questions yet. I'll wait to see if anybody's got any. Just I was going to ask Melanie, perhaps if you could talk about some of the ways that maybe you know, local government planners might use the Australian Urban Observatory. Have you got sort of examples of the types of work where it would be really useful?
Yeah, like I'm just thinking an example at the moment that I'm aware of is maybe if you're doing a review of access to public open space within a council, and they're trying to understand are there areas that we should be putting in more public open space. And I did have a slide on public open space, but I cut it out because I was trying to keep to time. But I think, you know, going through the last year that we can see that interest and popularity. And you may have also seen the article in The Age that my PhD student, Juliana Rozek, produced, looking at population density and access to public open space. That, you know, putting these pieces of information together to think, well, do we need to increase? And I know that, say, the City of Moreland, they have been looking at increasing their or creating new parks in terms of public open space access, but really trying to target that to where population density is highest and those missing gaps. So that's just one simple way. We also have, there's a book chapter that I've written with the great people from Cardinia-shire that looked at how they've used the indicators to develop a 10-year municipal public health and wellbeing plan. So that's a real on the ground, how did we do it? Where did we connect the indicators in? And I'd be happy to share that with anyone.
And Julie said that the most exercise she gets is running for the bus, and it's very unappealing if it's hot and trees cool footpaths. So is tree cover included in the mapping?
Well, this is a great question again, and Robin, you will know well that Joe Hurley and Marco Amati have been doing great work, and I encourage you, I should try and look up the link and put it in the chat, to look at their latest report that looks at tree canopy coverage across the cities of Australia, and they've done that at a local government area level to look at where the trees have gone in terms of increase and where tree canopy coverage has decreased. Within that recent project, we have been talking to see if we could get those results into the observatory. Unfortunately, we couldn't go down to that detailed level, but that is in the plan. We just need the ability with some funds to support that work so that we could make this available down to that neighbourhood level. I also encourage you to look at Marco and Joe's work with Shadeways in Bendigo, where they've actually created an app to show you the coolest route in terms of getting from a place from A to B. These are my Centre for Urban Research colleagues, and we were trying to work together to get that happening.
Now, Ellie's said this is a bit of a different question, but what's the governance structure behind the Australian Urban Observatory? Does RMIT own it, or is it an independent, unincorporated entity or a not-for-profit?
And anything that is created at any university, Ali, you may well know, that becomes the intellectual property of that institution. So RMIT does own the Urban Observatory. And I just wanted to go back to another point too about running to the bus stop. And I think it actually is a great example of why people don't think of public transport access being connected to health. And it's not literally because you were running to the bus stop, but I think it is that incidental exercise that people do when using public transport that people don't think about. They think that public transport, and we have these strange kind of social cultural issues within Australia, particularly, you know, there's a bit of that too within Melbourne, that, you know, people, I'm not going to put myself below those other people and go and get on a public train. No, it's actually got this huge health benefit for the fact that you have to walk places in using it. And I think sometimes that gets lost between people who are in transport and people who are in health.
Yes, it's a great pity that just at the moment people are worried about using public transport for health reasons. It's a fear that we're going to have to work on, I think. Look, Tim Knowles just commented that trees are the best, most economically productive use of public space. Mature canopy trees are valued at providing $50,000 of annual benefits.
I love it. And you know what? We've actually been working on a project for the last 3 years, an ARC linkage, looking at the benefits of street trees to people and wildlife. And we've done some intercept surveys on the benefits of trees to people and hope to get that research out over the next few months. So I am completely with you. Thank you, Knowles.
And Lucy's just commented that lots of people are missing their commutes and she misses the ride to the office. I used to walk into RMIT every day and I certainly miss doing that. And
yeah, I agree, Lucy. I think we're some of the few people who are missing their commutes. I'm one of those people too.
Yes, although there's, for a while anyway, there was a lot less traffic on the road. Okay, this is a great stream of questions. The tough hills added value, says Lucy. Okay, I wonder if anybody from the earlier, Julie saying, really hope you do get funding to put tree canopy in. That would be excellent. It certainly would. I wonder if any of the earlier speakers, if Annette or Belen or Lucy want to add anything to any of these conversation threads we've had.
Yeah, and it's nice to see your faces. Come back on, people, so we can really realise, yay, there's real people here.
Melanie's feeling lonely up there. There's Belen.
I'm actually not sure if you can see me. My camera gives me stupid. It shows that you can see me, but I'm not sure you can.
No, we can't see you at the moment.
Okay.
Not to worry.
Yeah.
It's a nice photo anyway. So does anybody have any more questions or comments? That was great, great conversation there. Otherwise, I'm happy to wind up 10 minutes early. Annette, yeah.
Yeah, just for me, the question is if anyone else has other questions to our other presentations. So I think the last bits have focused on the Australian Urban Observatory, and maybe some people have now come up with questions on the health impact assessment or would like to make the connection or come back to the Slido questions actually, where they've put things in. So that would be my question to the others.
Yeah, I think, Annette, you know, if we were to think about questions that even asking people about the health impact assessments, you can see that we had a few in the yes, no, maybe categories. If anyone wants to make comments about what they think their reasons are or why, that might be really interesting to talk about.
While people think about that, we could just say, Annette, about the transport for growth suburbs. Noel's put his hand up. I'll just finish this comment. Project, which is continuing on till next year. We didn't cover all of it because it has been a 3-year project, and we're hoping to produce a number of different sorts of outputs from the project. So there'll be one sort of heavy final report, which will have all the bits, and then there's already released quite a few discussion papers and summaries of literature, and then we hope to produce some much shorter, pithier findings that'll be more useful for policy. So if anybody's interested, again, I urge you to put your details in the chat or drop us a line later on if you're interested in getting more of our results. Now, Noel, what was it that you were going to ask?
Yeah, very quickly, I was one of the people who was not too sure about the tool or tools, and I think it's probably more important to have education and awareness around amongst the planning fraternity, because I reflect on something like the parking requirements, which sort of came out of a tool that makes everything easier, and we just apply the same rate everywhere, no matter what the situation. And I think that really devalues the reality of what goes on in different situations. So I'm much more aligned with, let's educate everybody about the health benefits of certain outcomes, if you like, and we can then show people how trees reduce the urban heat island and do a whole lot of other good things. That's probably going to be better than any tool we can come up with, I think.
Okay, I'd just like to say thanks very much for your comment, Knowles, because I think when we finished our presentation, Belen and I had a quick chat over the phone. You said, "Oh, no questions," and I said, "I think we need to build the capacity in our audience to understand more about health impact assessments." So there is a full process for a health impact assessment, and we didn't have time to go through all of the steps that are involved. And Melanie's running a wonderful course at the moment, which is talking about integrating health into planning practice. And I'll be doing a seminar on that broader aspect of health impact assessments and going through what that process is. And it's a 5 to 6 step process, but essentially they are the same steps of scoping, understanding, well, screening first, so understanding whether you need to do a health impact assessment, scoping it, so how big should it be, appraising it. And for us, the appraisal component is where you start bringing in these different tools, but working with your partners. And the whole process of health impact assessment is meant to be very collaborative, depending on the scope. It is meant to bring in people who drill into that detail to say this is the right balance for what's required, which is what you're essentially saying, that using a tool is only part of the process. But I think particularly for us here in Victoria, that there is a need to really build capacity in understanding what a health impact assessment is. And there's also it's almost, I hesitate to go into too much detail, but it's not legislated to be done here in Victoria. So environmental impact assessments are to be done for large projects, but health impact assessments are not. And had it been done, we might have some more trees in the Jabberwong trees might still be here if there'd been more emphasis on understanding the mental health impacts of taking those trees away due to an infrastructure project. So this is why it's important to have them, but at the same time, at the moment, there's not a lot of traction yet, and we're trying to get that traction. But a large component of it, just wrapping it up, is getting more understanding of what they are and giving people the skill to do it for themselves and understanding at what level they get done. So yeah, I completely appreciate your comment.
Maybe a peer session, Knowles.
Exactly. Yeah, let's go.
We could do a peer session. You let us know. Yeah, we could fit one in.
Robin, you're muted.
Sorry, my phone rang and so I quickly muted myself. Ben's put a question in the chat. I don't know if you can see it. With the question raised for the provision of health and wellbeing in transport impact assessments, would this be better suited to consideration of plans where the assessment is provided to the end user who can see their benefit?
I guess the short answer is yes, absolutely. I think that health benefits should be explained. Sorry, now it's my dog barking at the doorbell ringing. Yes, they're definitely worthwhile getting that to the end user as well. And Belen, if you've got any comments to add, I might just put myself on mute, else the dog goes bonkers.
Well, Annette's put her hand up. Belen, jump in if you've got something to say, otherwise we'll...
No, Annette, go ahead. Thank you.
Yeah, it wasn't in relation to this, though. I just wanted to actually add to what you just said, Robin, before, that we are nearly finished. Well, that we'll have the final report and a lot of other disseminations sources, and that's why we actually asked what you were interested in. And I just thought I might quickly mention before we finish that we actually have a local government webinar next week with the same projects. It will be kind of similar because we're talking about the same projects, but we want to focus a bit more on what is actually important for local government. How can local government use it? And I just wanted to mention that quickly. And well, if you're interested, I think everyone has my email address because I've sent out the invite. So just let me know.
Okay, and just a thank you note there from Lucy saying great webinar. Thank you to speakers and chair. Oh, thank you very much. All right, well, look, Melanie's just posting where to register. I think we might at that point then draw it to a close. I always like to give people back a little bit of time. They weren't counting on, if possible, it's only 5 minutes, but you know, it's a lovely day, so you can use it for a little bit of incidental exercise or deliberate exercise. Okay, so thank you all very much. Thank you to the presenters. That was terrific. And thank you for being such an engaged online audience. Do stay in touch with us if you can. We only do this research so that it is useful to other people, and we certainly want to engage with people that might use it. Thanks very much for all of your attention and for everybody's engagement.
Thank you. Thanks very much.
Thank you. Thank you all.
Bye.